Welcome to Hello Doctor Talks. Today we are going to discuss about psoriasis. To discuss more on this, today with us we have Dr. Colonel K Prasad. Dr. Colonel K Prasad is a dermatologist, aesthetician, cosmetologist and venereologist of vast experience of more than 35 years in the specialty and alumnus of the prestigious Armed Forces Medical College Pune. He served in the Army Medical Corps for more than 33 years. Presently Head of Department Dermatology, Medicity Institute of Medical Sciences, Medchel, Kanpur, Hyderabad since 2012. Doctor, what is psoriasis and what causes it?
Psoriasis is a very common chronic condition of the skin which appears as reddish patches with scales which fall off easily. It's a scaling disorder, and these scaly patches develop all over the body. It's primarily a genetic disorder which runs in the families. Many times patients say, Doctor, nobody in the family had it. Possibly, it may have started here, but it has got a genetic basis and it's an autoimmune disorder where the body itself starts making certain immune substances which go and attack the skin and start signaling that skin should, the turnover of the skin increases and much faster than the normal individuals.
Doctor, how many types of psoriasis are there?
Psoriasis are of various types. One, what we call as the common psoriasis or psoriasis vulgaris or chronic plaque psoriasis, wherein the patient develops, as I said, reddish patches of various sizes, which are scaly patches all over the body, including scalp, and even the nails may be affected. Apart from this, some people may only have scalp psoriasis, limited only to the scalp, which gets treated over the years that as dandruff. Only the dandruff tends to be more diffuse and less small scales, like rice bran scales, whereas psoriasis has thick micaceous, that is just like mica, if somebody has seen them, like mica or scales are there, thick scales are there. And if we ask the history, they may come up that yes, my grandfather also had dandruff, severe dandruff. Many people go through life with just severe dandruff and that never realize that they got psoriasis. Apart from the scalp psoriasis, there are nail psoriasis where the nail shows dystrophy. Then there is what is known as flexural psoriasis. Usually the psoriasis on over the body, but sometimes it occurs in the groins or axilla. That is known as flexural psoriasis. Plus, one of the most serious ones is the joint psoriasis. Psoriasis can affect the joints as well. It's a multi-system disorder which not only affects the skin, it can affect the joints. And these people have a higher tendency of having cardiovascular problems also. It's one of the metabolic diseases. So it can affect the joints. And the joints can be usually one or large joint like knee or ankle will be affected. Or occasionally like in rheumatoid arthritis, multiple small joints can be affected. So there can be psoriasis with joint, and there is erythrodermic psoriasis when there is, because of sudden stress, the whole body starts becoming red and starts scaling all over, and it is a medical emergency.
Doctor, can stress triggers or worsen the psoriasis symptoms?
Yes, psoriasis is related to stress, both mental stress and physical stress. Sudden changes in atmosphere, sudden changes, especially in cold season. Psoriasis, as a rule, tends to occur first time in early summer. However, it has a waxing and waning course, and it worsens during winters, improves during summers. So, if a person who's had mild dandruff or something and stays in the, say, Kerala, or he's from Kerala, he goes suddenly to places like Srinagar or colder areas like Shimla, he can suddenly develop full-fledged psoriasis. So yes, climate has got a role, and stress, both mental stress and physical stress, has a role.
Doctor, what are the treatment options available for psoriasis?
There are multiple treatments. There are topical treatments, then there are oral treatments, oral and injectables also. In topical treatments, if it's a mild case, we have cleansing agents, mild anti-inflammatory agents, mild topical steroids. If it is more severe, we may have to give high potency topical steroids also. But these steroids should only be taken under the direction of a dermatologist. Not people have a tendency to go to medical shops and ask the shop owner to give some treatment, and he gives something and it becomes worse. That should never be done. One should consult a dermatologist and take the proper treatment. Then there are, for loosening up the scales, we have got salicylic acid ointments, there are vitamin D analogs, there are so many topical treatments are there for mildly. But when psoriasis goes beyond 20% of the body surface area, for example, a palm is taken as 1%. So when more than 20% of body surface area is affected, then one has to go to systemic treatments. The systemic treatments include physical treatments like light, ultraviolet light, ultraviolet A and ultraviolet B, both body chambers, but for these treatments one has to go to the hospital. At home, for tablets, can be given same light, we can use sunlight, we give Soranin tablets and ask the patient to expose to sunlight for a certain length of time. Then, since it's an autoimmune disorder, certain immune modulators are given, like methotrexate. It's a anti-cancer drug, but in psoriasis it is used in much lower doses, once a week or so, and very, very low doses with proper monitoring. Then there are newer drugs like apremilast which can be used. Then for severe cases, we can use azathioprine, we use cyclosporin. There are multiple series of drugs. And the latest on the block is monoclonal antibodies like infliximab, secukinumab. These are to be given in hospital setting where it is required that patient has got severe psoriasis and requires faster control. The dermatologist will determine who should undergo which treatment. But main thing I would like to stress here is whatever treatment has been determined by your dermatologist, you should follow it regularly and religiously without stopping it on the advice of other people outside. I've seen so many people stopping, oh, this is an anti-cancer drug, you should not take it. And they stop it and they come up with a flare-up. That should not be done. One should always consult the dermatologist and do according to his or her directions.
Doctor, how long does psoriasis takes for the treatment to show the results?
See, in smaller, milder conditions where less body surface area is affected, only 1 or 2 patches are there. Regular usage of ointments over 1 to 2 weeks may control it or begin to control it. When I say controlling, the first thing to reduce is the erythema, and then the scaling will go down and then it will become flat. But then one should not stop the treatment suddenly. If one stops the treatment suddenly, it rebounds. It's something like you throw a ball against a wall hard, it will come back to you. The treatment should be stopped slowly. If you roll a ball along the floor, it will go and stop at the wall. But if you hit it hard against the wall, it will come back. So psoriasis treatment should never be stopped suddenly. It should be slowly brought down after the patient responds. Where the requirement of oral drugs are there, whether methotrexate or cyclosporin or acetylene, whatever, the usual duration after which we can expect some response is 3 to 4 weeks. There's no point of expecting miracles that in 2 days it should vanish. No, minimum 3 to 4 weeks are required to show any results.
Doctor, can psoriasis affect to other organs and it can lead to any other complications?
Complications I already told when I was talking about types of psoriasis. The main complications that can occur is joint psoriasis. The second is when whole body suddenly breaks out into becomes red and starts scaling all over. That is erythrodermic psoriasis. These are two main complications. Other than that, psoriasis is now recognized as a metabolic disorder, and it occurs more frequently. Like when I say occurs more frequently, say diabetes or heart problems, or cardiovascular problems. Cardiovascular problems do not cause psoriasis, and psoriasis will not cause cardiovascular problems. But they tend to occur more together. Same thing with diabetes. Diabetes, hypertension, cardiovascular problems, and psoriasis, they tend to occur together in the same cohort. Possibly there are research, which is elegant research is there, why they tend to occur together. They are all classified as metabolic disorders.
Doctor, what are the most serious type of psoriasis?
Most serious type of psoriasis, I already said, the one is erythrodermic psoriasis. The other one is joint. So joint psoriasis is 5 types. One affecting only small joints, one affecting a slightly larger rheumatoid arthritis type, and the larger joints are affected. Then one thing, one is known as arthritis mutilans, which is very, very, very rare, and it is more common in the Western populace rather than our country, where the multiple joints get affected and the patient can barely move. So that is the most serious form of psoriasis. But fortunately, in India, genetically, not many such cases are seen.
Doctor, can psoriasis be cured permanently?
In one word, if you have been listening to my talk from the beginning, no. Psoriasis can be controlled, it can be, the quality of life can be improved. But to cure psoriasis, you have to cure the genes. It is an autoimmune disorder which is determined by the genetics and triggered by the environmental factors. So, unless the genetics change, you cannot change it. So, the tendency to psoriasis will be there and will be running in the families, but interplay of genetics and autoimmunity and the environment, that's what brings it forth. Once I keep telling my patients, psoriasis, once it appears, it's like a marriage. A person gets married, he is married for life. Even if he divorced, he is married and divorced, he is not unmarried. So, psoriasis, once one gets it, it is for life. One can manage it, one can look after it, take care, and improve the quality of life. But to expect a permanent cure of for psoriasis is like me expecting my all fingers to grow up to the same height. Not possible.
Doctor, is there any food that controls psoriasis?
No food per se that controls psoriasis, but certain foods contain ingredients which are salutary in nature, like omega fatty acids. Omega fatty acids help in mitigating the symptoms of psoriasis. There are vegetarian sources and there are non-vegetarian sources. Flaxseed is a very good vegetarian source, and they are available in capsule form also. And those who have fish, especially sea fish, they contain a lot of omega fatty acids. But that doesn't mean one starts to eat. If somebody who has not eaten fish ever should start eating fish. Those who do eat fish can have more of it, or it can be taken in capsule forms.
Doctor, are there any lifestyle changes or home remedies to control psoriasis?
Lifestyle changes include the same: rest, good sleep, good exercise, healthy balanced food, avoid alcohol, because as I said in the beginning, there is redness in the skin and scaling. Alcohol increases the blood flow through the skin and the redness will increase and more scaling. So alcohol, smoking, all these things will have an effect on psoriasis. And sedentary lifestyle. If in these days most of the people are office bound, so sedentary lifestyle will worsen psoriasis. One should have an active lifestyle, exercise at least half an hour a day.
Viewers, hope so we have clarified your doubts regarding psoriasis. If you still have any queries about this, kindly mention in the comment box.